This is the brain tumor case study, the glioblastoma tumor by Lacey, Elizabeth, Ulysses, and Anya. Next slide, please. So here's the case. Next slide. The overview. We have a 42-year-old male. He has prolonged seizures, resolved with medication thus far. No personal or family history of the seizures. He has complained of altered vision and increased headaches. There's no prior medical history and is not on any medications. We have a CT scan and biopsy that show the glioblastoma tumor in the occipital lobe, as you can see in the photo to the side. Next screen. A little bit of the patient profile in depth. We have the age of 42-year-old. He's male, height is 6 foot 8 inches. The weight is 198.4 pounds. BMI is 26.9, showing that he's overweight. We have vital signs of the BP, 150/96. The pulse, 74 beats per minute. Respiratory, 16 beats per minute. Temperature is 98.4 degrees Fahrenheit. The OT saturation is 97%. The Glasgow Coma Scale, CS 15/15. He's complaining of right-sided diplopia with cytosis on the same side. Psychosocial, he lives with his partner. He's a lawyer and plays occasional sports. Socially, light drinker. He's a smoker, 1 pack a day. Next slide. So what we know compared to what we need to know. We'll start with what we know. The smoker 1 pack a day is obviously something we want to pay attention to. He is overweight. The blood pressure is very high. And as a lawyer, of course, work is very stressful. And so what we need to know is what is a glioblastoma tumor? What are the symptoms and causes? Is there a treatment? Is it hereditary? What is Glasgow Coma Scale? Has he previously had any other symptoms? Why did he have a seizure in the first place? Why is he experiencing the double vision? And what is causing the headaches and the droopy eyelids? Next slide, please. Now this is the case analysis.
A brain tumor is a mass or growth of abnormal cells in the brain. Many different types of brain tumors exist. Some brain tumors are non-cancerous or benign, and some are cancerous, known as malignant tumors. Primary brain tumors originate in the brain tissue that are close to it, such as in the meninges, cranial nerves, pituitary gland, or pineal gland. Tumors begin when normal cells acquire errors, also known as mutations in their DNA. These mutations allow cells to grow and divide at an increased rate and to continue living where healthy cells would be. Mutated cell growth. Cancer cells are different from normal cells in ways that aren't directly cell cycle related. These differences help them grow, divide, and form tumors. Cancer cells gain the ability to migrate to other parts of the body, a process called metastasis, and to promote growth of new blood cells, a process called angiogenesis, which gives tumor cells a source of oxygen and nutrients. Cancer cells also fail to undergo programmed cell death or apoptosis under conditions when normal cells would. Example, due to DNA damage. In addition, emerging research shows that cancer cells may undergo metabolic changes that support increased cell growth and division. As shown in the illustration, on the top it says normal cell division, where a mutation or a damaged cell were to grow, it would kill itself or commit cell suicide or apoptosis. In cancer cells, the division carries on and it starts mutating further and further and further until it has an uncontrolled growth, and that is how the mass or tumor continues to grow. more into the glioblastoma tumor. Glioblastoma multiforme, or known as GBM, also is a fast-growing glioma. A glioma is a type of tumor that occurs in the brain and spinal cord. Gliomas begin in the gluey supportive cells, known as the glial cells, that surround nerve cells and help them function. Laurel Kelly, Mayo Clinic. GBM is often referred to as a grade 4 astrocytoma. These are the most invasive type of glial tumors, rapidly growing and commonly spreading into nearby brain tissue. They grow approximately 1.4% in a day on a microscopic level, but can double the size in 7 weeks. GBMs can arise in the brain de novo or evolve from lower grade astrocytomas. In adults, GBM occur most often in the cerebral hemispheres, especially in the frontal and temporal lobes of the brain. GBM continued. The median life expectancy after being diagnosed with GBM is about 12 to 18 months. They are slightly more common in males and elder people. The average age for a glioblastoma diagnosis is at 64 years old. GBM has an incidence of 2 to 3 per 100,000 adults per year, and accounts for about approximately 54% of all primary brain tumors. The causes is still unknown, but increasing research shows that several different genetic mutations are involved in the development of these cancers. They can be caused by inherited DNA defects. It has been seen commonly in cases where patients have previously gone through chemotherapy or radiation therapy. Astrocytes are very controlled and organized cells. It is unknown what happens that causes them to start multiplying and forming tumors.
Diagnosis. A regular exam will be done with your primary care provider. And if they think you may have a brain tumor, the following tests will be done: MRI, CT scan, magnetic resonance spectroscopy, needle biopsy, blood test. Symptoms: persistent headaches, nauseous, vomiting, loss of appetite, drowsiness, double, blurred vision, personality changes, seizures, changes in ability to think and learn.
Okay, so here's a picture of the lateralization of cerebral functions, and it's explaining a little bit about it. Next slide, please. So here are Tiki's symptoms explained. He has a persistent headache, and basically the brain doesn't sense pain itself. Headaches are caused when the tumor presses on the nerves. He's also having seizures caused when neurons' electrical impulses are suppressed, interrupted, caused by the tumor. There's eye drop or blurred vision. Tumor is found on the left occipital lobe, marked on the image to the right. The visual cortex is found there, receives segments and integrates visual information. The right eye nerves communicate with left occipital lobe. Next slide, please.
Treatment: medication to stop seizure and to reduce swelling in the brain. Radiation to destroy and shrink brain tumor and cancer cells. Chemotherapy used for fast-growing brain tumor and elevate risks for a new cancer. Surgery to remove a brain tumor as much as possible.
Okay, and then here's a conclusion. There are multiple environmental factors that could have caused Tiki's diagnosis of glioblastoma. After looking further into the causes and characteristics, it can be presumed that the cause of the tumor could have been an unexpected cellular mutation. Next slide, please. And then here are the questions. Question number 1 is, where is the glioblastoma tumor cell found? We have A, spinal cord and extremities, B, brain and cranial bones, C, brain and spinal cords, D, all of the above. Question 2, what is believed to be the cell that caused these type of brain tumors? The glioma cells, neurological cells, white blood cells, and D, stem cells. Question number 3, which is the treatment used for glioblastoma? A, rest, B, radiation or chemotherapy, C, therapy. Next slide. Question number 4, what do cancerous cells fail to do when mutation occurs during division? A, detect mutation, B, cells suicide apoptosis, or C, none of the above. And the last question is, what is causing Tiki to have vision issues? Please explain. Next slide. And then here are just the works cited.